My name is Kaci, and for my evidence-based practice project, I decided to focus on shift report and how moving it to the bedside is going to improve our patient care. What is shift report? Shift report is what happens between two nurses with the patient, like on the day shift, and then also the nurse that's going to take care of the patient on the night shift, where they exchange information so that the oncoming shift is going to be able to adequately take care of the patient. Shift report is very important when it comes to patient safety because that is where the number one communication between nurses takes place. According to the Joint Commission, miscommunication is one of the leading factors in sentinel events, and the majority of communication between nurses occurs at patient handout report. Patient safety is directly affected by the manner in which shift report is given between nurses. This is because if certain information is missed or given incorrectly, it could greatly affect the patient and very much so decrease their safety. So what is bedside shift report? Bedside shift report is when both the day shift nurse and the night shift nurse exchange patient information actually in the patient's room at the bedside. This allows both nurses to actually lay eyes on the patient, kind of see what is hooked up to the patient, like what fluids are running, what meds they might be given, see the condition of the patient, so that both nurses are kind of on the same page with where the patient is at the end of that shift and at the beginning of that shift. Moving shift report to the bedside. Moving shift report to the bedside improves patient safety because both nurses are actually seeing the patient, like I said, and patients can become more involved in their personal care. Bedside shift report involves the patient in their care, and patients are better informed about their care, which improves patient satisfaction. This allows the patient to hear what the nurses are saying about them and allows them to, add things to what they're saying or maybe correct things that they might have said, and it makes the patient feel more involved in their care. Moving shift report to the bedside continued. My goal in us moving shift report to the bedside is improving satisfaction of giving report by the nurses. This is so that nurses aren't complaining about maybe missing something in a report or how, we all give report differently. This kind of gives a standardized way to give report so that all nurses are happy. This also improves patient safety by adequately exchanging the correct patient information during report, and it improves patient satisfaction by allowing patients to be more involved in their care. So, problems with the current report process. Miscommunication during shift report is usually caused by nurses who are rushing and not giving the oncoming nurse a thorough report. There needs to be a standardized process of giving report between nurses to ensure that pertinent information is not missed. Patients are not currently involved in the process of shift report, which decreases patient satisfaction because the patients feel out of the loop with their care and the information that is being shared about them. So how does moving shift report between nurses to the patient's bedside impact patient care compared to conventional methods of shift-to-shift report? So the benefits of us moving report to the bedside, as mentioned before, it'll improve patient satisfaction, improves nurse communication, improves teamwork between nurses, it decreases report times given a shorter report, and it increases patient involvement in their care. So how do we promote this change? To promote changing to bedside shift report, adequate education will have to be provided to our unit, and a standardized report process will have to be developed, and all nurses on the unit will have to be willing to comply. This is going to be a big change from the way that we are giving report now because, it might be uncomfortable at first to be talking about the patient right there in front of the patient, and it also, we're not used to having one standardized way of giving report, and so this will kind of put all nurses on the same page, but it'll also involve, we're going to need to be educated on how to do that to be able to do it well. Having an adequate process of exchanging patient information is imperative to providing continuity of care and positive patient outcomes. Exchanging patient information at the bedside ensures that all important information is given and the patient has the opportunity to add or object to the information given, promoting positive patient outcome. So how will we evaluate this? The most beneficial way to evaluate this change would be through a survey and through observation. A survey would need to be given to all the nurses and patients that are going to be involved in this change in report to evaluate the changes in satisfaction. So clinical educators or our nurse leaders would need to observe us or the nurses when giving bedside report in order to evaluate its effectiveness and to see if it's being done correctly. So evaluation should begin about 3 to 6 months after the change is implemented in order to see if we're heading in the right direction or not. So the outcomes I expect by changing this shift report would be there would be a more efficient shift report where it's in a more timely manner and our nurses are satisfied with it. Improve nurse and patient satisfaction with the reporting process, and improve communication and teamwork between nurses. So in conclusion, moving shift report to the patient bedside will ensure patient safety and satisfaction and improve the communication between nurses during report. So if anyone has any questions, just please let me know and I'll be able to thoroughly explain it to you. And these are the references I used in my presentation.